If you're over 50 and you're looking for back strengthening exercises, then this video is for you. I'm Dr. Dave Candy, and in this video, I'm going to explain the 3 best back strengthening exercises to help relieve lower back pain, particularly if you're a senior or over the age of 50. Now, there's a common misconception that by getting your back muscles stronger, it'll help your lower back pain. But for many middle-aged to older adults, actually the reverse is true. A lot of people with chronic lower back pain have back muscles that are in spasm all the time, hence causing their pain. But getting your core stronger, particularly your abdominal muscles, your glutes, and little small muscles deep close to your spine called the multifidus, are helpful to relieve lower back pain. So one of the most common exercises that people do to strengthen their abdominals is called a pelvic tilt. But if you have trouble getting down on the floor, then the traditional laying down pelvic tilt may not be optimal for you. Furthermore, it doesn't necessarily translate into having better function when you're standing and when you're walking, which is the time when most people over the age of 50 have lower back pain anyway. And so to improve your lower back pain when you're standing and walking, it is helpful to strengthen your abdominal muscles by doing a pelvic tilt, but doing that in a standing position. So to do that, it does help to bend your knees just a little bit. You don't need to be in a deep squat, but you probably will find it a little bit easier if you unlock your knees and kind of roll your pelvis under you. Then tighten your tummy muscles and also tighten your buttock muscles at the same time. And then hold that position for at least 10 seconds. Now, the goal is ultimately that this isn't going to be an exercise per se that you do 5 times or 10 times or 20 times for 5 seconds or 10 seconds or 20 seconds. But eventually you want to get to where you can do that pelvic tilt at a low level throughout the day, particularly when you're standing and walking. Because when you stand in an arch like this with your lower back arched, it jams the joints in your lower back together. It can also start to pinch on your nerves, particularly if you have degenerative disc disease or spinal stenosis. And so standing in a position like that is not good for lower back pain. And if you can learn to stand a little bit more like this by tightening your belly muscles, squeezing your bottom muscles, and then holding that position throughout the day. Now, you don't want to bear down and do it as hard as you can, especially as you're first learning, because your muscles are going to tire out quickly. So instead of doing it 100% where you really tilt everything under, just do what feels kind of difficult, back off a little bit, and then just kind of hold it in something that could feel rather easy, and you could hold that position for 5 minutes, 10 minutes, 20 minutes, however long you're going to be standing. So that's exercise number 1, doing a standing pelvic tilt. Now, exercise number 2 is probably the most controversial of all the exercises, and that's a deadlift. Now, there are many people who think you should never do deadlifts if you have back pain, or never do deadlifts if you're a senior, but doing deadlifts is actually a normal functional movement. If you ever pick anything up off the ground, say a grandchild or a dog or cat, or you have a package out on your front porch, anytime you bend down to pick something up off the floor, you're doing a version of a deadlift. Now, that's not to say you have to throw hundreds of pounds on a bar and do deadlifts, but doing a light deadlift is a great way to improve the strength of your glutes, somewhat your lower back muscles, and your abdominal muscles all at the same time. Now, if you're just a beginner, start with very light weights or even no weight. For example, you can just use a dowel rod. So to start the exercise, you want to roll your pelvis underneath of you, kind of just like the first exercise. Then push your hips back, lowering the weight down, squeeze your bottom muscles, and pull your hips back underneath of you. Push your weight back, slide the weight down your legs, squeeze your bottom muscles, and bring your hips back underneath of you. Now notice this isn't a back bend movement. There's actually very little spinal movement. Most of the movement is taking place at your hips. So again, you push your hips back, weight on the heels, squeeze your bottom muscles or squeeze your glutes, contract your abdominal muscles at the same time, and push the hips back underneath of you. If you watch the change in contour of the back, again, it's not a bend like this where there's a lot of motion happening at the back. It's also not staying in a big arch where there's a big gap between the stick and your spine and going down like that. Your lower back should be relatively flat on the stick at the start and stay flat on the stick throughout the bend. Stay flat on the stick on the return. Hips back, hips forward. And again, start with lightweight or a dowel rod and then progress to heavier weights, however heavy you need to use to get a good strengthening workout without causing further pain or discomfort in your lower back. Now, exercise number 3 is a modified bird dog. And the bird dog exercise is an exercise where you get on the ground and go like that. But for many seniors, there's the problem of 1, not being able to get down on the floor, 2, having knee pain from kneeling on their knees while they're doing the exercise. And so a modified version of this is a good exercise to strengthen your glute muscles, as well as the small multifidi muscle or multifidus muscle, which controls the rotation in your lower back. Now, to do this, you probably do want to have something to hold on to because this does take a little bit of coordination. So if the bird dog on the floor is doing opposite arm and opposite leg, you want to do that same thing as you're standing. So hold on with one hand and have the other hand free. Now the hand that you're holding on with, you're going to stand on that opposite leg and you're going to raise the same leg as the hand you're holding on with. Then you're going to raise the other arm out in front of you and hold it. You don't want to allow twisting, so you don't want to allow your leg to rise up too high. You also don't want to allow your back to twist like that. So try to keep your lower back relatively still and flat and raise the arms up that way. You get a little bit of a balance exercise here, particularly as you start to take more and more pressure off the chair. And eventually when you get really good at it, you could do a standing version like this. But I would highly advise for safety using a chair or a piece of furniture to hold on to when you first start that exercise. So just to quickly review, strengthening exercise number 1 is a standing pelvic tilt, and you want to learn to do this for as long as you possibly can at a low level throughout the day. Exercise number 2 is a deadlift, starting with a dowel rod or lightweight and progressing from there. And then exercise number 3 is the standing bird dog, where you do one arm and the opposite leg. So those were the exercises to help you relieve lower back pain, particularly if you're over the age of 50. Now, if you are over the age of 50 and you're in the St. Louis area and you need more help for lower back pain, we'd be happy to help you out here at More for Life. And if you're watching this from somewhere else, but you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.